he went to 0 in 15 days. So this patient was referred to me by a pulmonologist, and since it is in Hindi, I will just not wait. There's no point in getting the voice, but I'll just explain it to you. So what we did, we explained to him, we treated him, we went through this ABCD model. We gave him some medications, including nicotine lozenges, and you see, was completely off tobacco. He had a lot of pulmonary problems. He was just very young age. All his pulmonary problems started solving, and he was much relieved. And his medications that the pulmonologist was giving started working on him. So these are some of the important. So now coming to important aspect. What is the methodology? What is this ABCD model? ABCD, as I have said, active motivation, behavioral therapy, comorbidity, this patient having cancer, oral lesion, problems, hypertension, diabetes, whatever it is, that needs to be taken care also. But very most important, very important factor, actually, which is the medication that we need to give to these patients, nicotine replacement therapy. There are two therapies that is nicotine replacement therapy and nicotine receptor agonist therapy, right? So today we will only talk about the nicotine replacement therapy, and these are the NRT models which are there. It can be nicotine gums, nicotine patches, nicotine nasal spray, inhalers, or nicotine lozenges. So nicotine gum has been present for many years. Patches are also available. Nasal spray and inhalers have just come in. Most important and easiest to give is nicotine lozenges, which we are going to talk about today. So showing the advantages of each of them, and you see this nicotine patches which is used, and this has to be applied onto the skin, right? And it has to be changed every 24 hours. And the nicotine which is there, it is again, it causes a lot of throat inhalation, irritation, and it has to be actually like any puff. You can actually use the puff as a puff. You take nicotine is another important aspect, which is put into the nose. One dose gives almost like 4 milligrams. The nicotine gum we have been using quite but there's a lot of irritation, burning, and patients have a lot of nausea because of that, and the taste is also horrible. It is almost so. Right now, the best thing that is available easily, that can be carried in pocket, and the patients can, and that is the nicotine lozenges. We are going to talk. If you look at the entire system of nicotine lozenges, you will see that it is this is a replacement for nicotine that is already the patient is taking. That nicotine is replaced equal amount as and when the patient requires into his blood, right? So it doesn't have any harmful chemicals because it is an inert. It has no and the nicotine that the patient takes during smoking, which chemicals, that is lozenges available in 2 milligram, 4 milligram, right? Available in multiple across the world, right? And it is acrylax nicotine lozenges, right? So it just needs to be put into the oral cavity, and it has got multiple flavor, but commonest is the mint flavor, which is available in the market. Right. So what does it do when you put it into the oral cavity? Slowly it starts dissolving in the oral cavity, right? It slowly dissolves, and we can easily see that. Okay, so it can be easily dissolved in the oral cavity. It slowly gets, the nicotine content starts coming into the blood. Most of this nicotine is actually observed through the mucous membrane, so it is easily observed through the buccal lining of the oral cavity, right? So it becomes easy, and no chemicals are there, right? There is no lead, no arsenic, and there is no need for carbon monoxide. So the actual dose, the actual need of the patient, the the tobacco, the nicotine requirement of the patient is met with this lozenges with these patients, right? So the absorption is through the buccal mucosa. It is either 2 milligram or 4 milligram. The volume distribution is there. The protein binding is less than 5%. It is metabolized in the liver, right, and excreted in the urine. That's the way it is working. So each nicotine, the half-life of each nicotine lozenge is around 2 to 3 hours, right? That is so it is mouth dissolved and it can be given easily into the oral cavity, right? The only thing that we want to make sure, please do not eat or drink before or after taking these lozenges. So now coming to how do you describe this smokers, type of nicotine and how much dose that we need to give it to this patient. That is another very important that we need to know. So there is a Fagenstorm scoring system. I think everyone who is dealing with tobacco cessation would be aware of this. This Fagenstorm scoring system actually is easy to just to put what type of, depending upon the score, depends. There is just 6 questions to that, and person depending upon the answer they are given points, and based on that points we can divide the patients whether it is patient is high dependence, medium dependence, or low dependence, or very high dependence, right? Anything more than 8 is very high dependence, right, or low dependence. So depending on this, we would start giving the type of lozenges or the how frequently we need to give the lozenges to this person. So these patients like who are in high dependence are usually taking smoking more than 20 cigarettes per day. The medium dependence, they are taking almost like 10 to 20 cigarettes per day, and the low dependence, they are taking less than 10 cigarettes per day, right? So the urges, again, because depending upon the time period, the urges or the requirement of the smoke is in the high dependent, it's every hour. In medium dependent, it is like 1.5 hours, and in low dependent, it is more than 2.5 hours. So how do we give this lozenges? This is how we give. That is, we divide into, see, the idea of this thing that initially we have to replace the total amount of nicotine that he requires with this lozenges that we need to give it to the oral cavity. When we are giving lozenges, let me repeat it, we are not giving them any other side effects like any other chemicals, the harmful chemicals or carcinogens, but we are giving them pure lozenges, which is a poloacrylates capsules or tablets, right? So initially, if the person, what we start is that in weeks 1 to 6, we start around 8 to 10 lozenges every hour. That is, if the patient is asked to take lozenges every 1 to 2 hours, right? Then after 6 weeks, for the next 3 more weeks, what we do is we half the dose. That is, we make it every 2 to 4 hours, and then for the next 2 weeks, we again half the dose to 4 to 8 hours, and then end of the 12 weeks, we ask them to stop completely. So this is how we ask, or we replace the total nicotine requirement of this patient with the requirement of the person, right? So this is again, whether the patient is taking smoking or whether the person is taking non-smoking. So this is also as good for the smokeless tobacco users. You know, this lozenges has got an added advantage for the smokeless tobacco users, because most of the time this smokeless tobacco, they want something to be there inside the oral cavity. You know, they want something to be there and they keep on chewing about it, right? So this particular one of the trials which has been done, the randomized trial, which has shown that smokeless tobacco users, lozenges is much better than any other models or any other thing that we give, even better than giving them these patches or even these gums. So this is important. And again, for youths who are taking 20 lozenges, 20 cigarettes per day or less than that, we can actually replace them with nicotine lozenges, which is again very easily. So this is also for the pregnancy and lactation. This is also important. If the patient, although first and foremost, we try for all these pregnant women or those who are on lactation, first we try if they can quit without any replacement, without any NRT or any NRA. But still, if they are not able to do that, then we can replace them or we can give them NRT. And we know that it is less harmful than the smoking that they are doing, smoking or chewing tobacco that they are doing. So these are some of the important aspects, and we know that this is means it is a US patented medications, and it can be done. There are multiple trials which has been there, and this is one of the graphs which is showing how there is a release of lozenges in the blood, and it is a constant, once the patient puts it in the oral cavity, it slowly gets dissolved in the oral cavity, the nicotine gets observed from the buccal mucosa, from the mucosal lining, and there is a constant supply of nicotine to the patient, to the body, and this person doesn't need nicotine anymore, or does not need to take tobacco of any form.